Okay. This is like take 7 or 8 now. I'm trying a new medium, so hopefully this will work out. Basically, the case conceptualization is on a client, William Whitaker. He's the protagonist of the movie Flight. Whip is an African American male in his early 40s. He is a professional airline pilot, and his reason for referral is it came from when he was piloting a pretty standard flight. There was a pretty severe mechanical failure. They lost all hydraulics, lost all control. The plane was diving towards the ground. Um, and he was able to innovate. He remained cool and calm, commanded other crew members to operate in different functions. He was able to invert the plane um, for some period of time and then negotiate it to a safe crash landing area out of 102 people on board, including 97 passengers and 5 crew. I believe he lost 5 or 6 people. Um, a significant save, but subsequent tests while he was in the hospital recovering from the crash um, resulted in the demonstration of drugs and alcohol in his system. What we know was that Whip had spent the night with in a pretty sleep deprived state. He was drinking alcohol, using drugs, cocaine, and marijuana with Caterina Marquez, a flight attendant with whom he'd had a significant relationship for some time. He also drank additional alcohol the next morning within a couple hours of the flight, as well as doing a line of cocaine, taking a hit off a marijuana cigarette, a joint. Um, and while that didn't appear to impair his function, as he performed some pretty miraculous activities, he still did have drugs and alcohol in his system, and was behaving irresponsibly before a very significant flight. Um, he doesn't appear to have a treatment history. There's no history of counseling or any psychopathologies identified before this time. Family history consists of him growing up on his family's farm just outside Atlanta, Georgia, um, with his mother and father. Both are deceased. His mother is not known. Not much is known about her history or the relationship. His father was a Tuskegee fighter pilot in World War II. He got out and returned to farming um, outside Atlanta and was a crop duster as well. So there's a history of flying in the family. Um, while not much is known about his relationship with his parents, there were a lot of family photos around the house, nostalgic mementos, so it can be reasonably assumed that he had a normal sentimental relationship with them. For his relationship history, he was divorced at the time of our introduction. He'd been divorced for some years. He has a ex-wife and teenage son. She divorced him due to his alcoholic behavior, his consumption amount of alcohol, and the subsequent behavior. Their relationship is acrimonious, contentious, and the son is estranged. When they do speak on the phone, it's pretty hostile if they do even speak. He does feel significant underlying sadness. There's regret and a sense of helplessness about the distance, but he tends to mask this in his day-to-day interactions. He's got a really natural charisma and confidence, and keeps occupied with his very busy life. Another significant relationship is Charlie Anderson, who he flew with as a pilot in the Navy many years before. Charlie Anderson also went on to become an airline pilot and has recently um, become a pilot union rep, hence his appearance um, to protect Whip after the airline crash. Another relationship he had was with Caterina Marquez, the flight attendant who died on the flight. He was the one who he was. She was the one who he'd been sleeping with and doing drugs and alcohol with the night before and morning of the flight. Um, Her loss affected him pretty deeply when he found out. He came out of a coma uh, and found out who had died, and that affected him profoundly. Finally, the other significant relationship in his life that we know of is Harlan Mays. Harlan Mays is a white male who is clearly a high-level drug user and supplier, constantly carries drugs and alcohol with him, and has supplied Whip in the past significantly. So our presenting problem history is that what appears to be a significant factor is that Whip seems to never have emotionally resolved the divorce with his wife, the loss of that relationship, and that with his son. These affect him deeply, but it doesn't appear like he's integrated them and moved on. He's still pretty stuck on them. We don't have much of a significant history of preceding socio-emotional pathology. Um, he was recognized by his good friend, longtime friend Charlie Anderson, the other pilot, as a heavy drinker. Um, we don't know about any counseling or any other diagnoses, but he does has his history of alcohol use, probable drug use, but we don't have any evidence of that, so it's hard to establish any diagnoses. Um, he does have this regular close friendship with Harvey Mays, the drug supplier, um, and he seemed pretty comfortable and confident in the one instance of him using drugs, so he seemed familiar with them. As far as a belief system, Whip exhibited no signs of having any religious experiences, no church attendance, didn't refer to God at all. It's very likely with his self sufficiency and competence, he's atheistic or agnostic. And then medically, he's very healthy, healthy male in his early 40s. To be an airline pilot, you have to maintain a pretty high level of physical fitness, meet some established standards. So we can safely assume that there's no apparent chronic medical concerns. He had some acute injuries from the crash lacerations around the eye. I think he had some torn ligaments on the left side of his body, his left knee, ankle, and wrist. Um, and then he had a concussion to some degree that wasn't quite elaborated on. Neurobiologically, nothing significant. Obviously, to be an airline pilot, yeah, you can't come in with any chronic conditions. So we have none identified thus far. And then educationally and professionally, Whip was an established and highly commended Navy pilot. He got into the civilian world, became an airline pilot. It's unlevel what it's unclear what level of collegiate academic experience he performed. Probably had a bachelor's degree. Getting to the military as an officer requires a bachelor's degree. To get a pilot, at least that. Um, and then they undergo pretty severe, rigorous training that's intellectually demanding. They have to understand a lot of physics, a lot of meteorology. Um, so we can safely assume he has very superior levels of intelligence, discipline, productivity. He has no established history of involvement in the justice system. Behaviorally, the observations that we do have, he comes across as very confident, charismatic, highly accomplished pilot. He is caring, he's highly intelligent, he's socially aware, and he's very self aware, very organized in thought and speech. He seems to be in denial about his substance abuse problem, as evidenced by being confronted a few times in his vehement denial that he was in control. He's in control of the rest of his life, and so why wouldn't he be here? Seems to be his reasoning. He did develop a relationship at some point with a former heroin user, Nicole, who went sober. Um, they had an intimate relationship for some time until his drinking. She was committed to staying sober, and he kept drinking and getting really drunk around her, and so she left him. Um, the crash and maybe that leaving of him seemed to move him into the contemplation stages of change. He'd been in pre-contemplation before, but he wavered back and forth on his own time. He did not like when he was confronted with this by somebody else, but he really did wrestle with it. He, on a few different occasions, he threw all drugs and alcohol in his possession around his properties away. And then he also relapsed a few times, and that seemed to be triggered by stressful events, being faced with this imminent National Transportation Safety Board hearing, um, going to an Alcoholics Anonymous meeting or a substance abuse meeting with partner Nicole, and a couple other instances. His character stands out here. He does seem to have a pretty strong sense of integrity and character when necessary. He had basically been absolved of all culpability legally. The drug tests that showed up in his blood content um, were able to be discharged. They were discredited on a technicality from his lawyer. They had set it up so that all they had to do was say that the empty alcohol bottles found on the airplane were attributable to Caterina Marquez, who had a previously established alcohol abuse problem. All he had to do was say that the bottles that he drank were hers, and she's dead, so can provide no reliable witness. But that seemed to be the breaking point for him. And so, in the middle, at the very end of the hearing, right as he was about to get off scot free, he acknowledges not only that he was drunk; those bottles were his. He was drunk on the day of the flight. He was drunk the day before, and he was drunk at that moment during the meeting. And he acknowledged himself as an alcoholic. He did accept culpability. Took a lot of actions of accountability following that. He wrote letters to the families of people who died on the flight and accepted their emotional response, whether they forgave him or not. He wrote letters of responsibility to his friends and family who had confronted him at various points of his life, including his ex-wife and son, and also acknowledged full acceptance of their forgiveness or lack thereof. He seemed genuinely remorseful, and then when we met him, which is about 13 months into his prison sentence, he had about 4 or 5 years left. He was showing up very vulnerably and honestly in a prison-based substance abuse recovery support program. As far as clinical interpretation, as I said, we don't know much about his personal psychopathological history or exposure to potentially traumatic events. He's a highly accomplished individual, sort of a type A personality. It's possible that that's compensation for something. He is an African American male, so there's potential for effects of intergenerational trauma. The substance abuse could potentially be related to his high pressure, high responsibility occupation as an airline pilot, just managing that, maybe managing some ego-based sense of high needs for accomplishment and feeling insufficient. Also significant is the aforementioned relationship issues. It doesn't appear like he resolved his relationship, the loss of his relationships with his ex-wife's son. We don't know the relationship with his parents. He may still be grieving over them. These all can contribute to his substance abuse. These are clearly sources of pain and loss for him, and the alcohol issue has been going on for a number of years. He is high functioning. He can manage a lot. Very intelligent, very charismatic, compassionate, adaptable. He's very capable of adapting to high cognitive loads, as evidenced by his conduct during the plane crash, where he was very much in control and calm and managing different options. And very significantly, meaningful relationships play a role in his life. He does care about the relationships in his life. He cares about their loss. They affect him profoundly. And so it seems like the drinking could be triggered by numbing or avoidant behavior for stressful events. Seems like he handles external events well, internally not so much. As far as treatment, I would recommend regular mindfulness practice to develop his capacity to tolerate discomfortable experiences, external, internal, to handle his emotions, and also to facilitate the grieving process to allow these possibly suppressed emotions to come up, this emotional residue from lost relationships. He's additionally going to have to face a whole new identity and meaning in his life, as he's lost his pilot's license and will most likely never fly again. He has expressed an interest through his actions in serving others. He was in the Navy. He was a Navy pilot. It's a high level of commitment, high stress, high demand. He stayed in there. That increases one's level of commitment and service to others. He was an airline pilot, also once again responsible for the safety and well-being of others. And then once he lost those, he showed up in his ability to serve others and make himself an example in the prison recovery, substance abuse counseling support system. So it's possible he may find fulfillment in a counseling or therapeutic career. So part of the treatment would be to recommend testing and undergo some training in that realm. Probably attending a 12-step program would be beneficial. He needs the social support, the contact, the change of identity, possibly a secular 12 support program, as it appears he's agnostic or atheistic. Um, Growth would be evidenced by sustained sobriety, obviously, and then repair of and increased quality of new relationships, particularly with his son. Um, Demonstrations of honesty, authenticity, vulnerability, tolerance of discomfort, and as I said, the relational repair would be significant measures of his progressive growth. Um, Professional behaviors, as I stated in my paper, um, I didn't know what this meant, and the grading criteria was a exact copy and paste reprint of clinical interpretation, so I didn't enter anything in for that. My inference was that the content that was supposed to go here is covered in the last section, limits of treatment, developmental needs, and ethics section. Um, so hopefully that covers it. As far as diagnostic oppression, pretty solid uh, sense of his diagnosis as falling under alcohol use disorder, F10.21, which is severe, presence of 6 or more symptoms. He maxed out on pretty much all of them, maybe 1 or 2 he didn't. But also in sustained remission. As I said, he's been in prison for 13 months at this point, at the point of interview. That's going to provide a very significant buffering factor. What future treatment will orient towards is when he gets out of prison in 4 or 5 years. That's going to likely build up significant momentum for establishing a solid foundation of sobriety. Um, but he's also protected in that he doesn't have access to it. And so treatment will focus on preparing him for re-exposure and free access and choice in consuming alcohol. I'm not going to go into all the criteria that's in the paper, but he maxes out on them pretty solidly. Um, the next section, cultural considerations. There doesn't appear to be significant factors here. The DSM's aspect under alcohol use disorder, the section entitled culture-related diagnostic issues, noted that despite small variations regarding individual criterion items, the diagnostic criteria perform equally well across most race and ethnicity groups. So it's not going to show up differently. Treatment is not indicated needing anything different. The part that I would address in cultural consideration would be the fact that he is a black male in a largely white male dominated profession, and so just including some explorations of his perceptions of a differential treatment or expectations as a black man, and then also his personal feelings regarding him being there. He comes from a flying family, so he's got a lot of pride in it, very likely. He identifies with it. And so investigations of him possibly feeling a need to perform at a higher level to preempt any racially based judgments against him. Regarding treatment weight, Whip's case is really unique among people with substance abuse disorder because he went through such a very intense, harrowing experience. That seemed to be his sort of wake-up call. Struggling with relapse and removing all drugs and then relapse and then quitting them all at once again. He has already accepted responsibility and accountability. And so it seems treatment would largely consist of supporting his recovery. He's taken the initiative. He's got a lot of inertia to it. So educating and preparing him for relapse, particularly upon release from prison, I think would be a focal point. As I touched on before, he's got significant buffers against relapse. He had the emotional impact. He had the very stark wake-up call of a plane crash in which people died that he was responsible for. He's got a strength of character. He's got support from Nicole, the heroin addict who he met in the hospital, who he had an intimate relationship with him, and she left him when he continued to relapse and get incredibly drunk. Once he went to prison, she came back into his life, and so he's been really strongly supported by her. His current confinement in the prison system is a protective factor. Again, that'll be compromised once he leaves there, but he'll have built up a foundation about 4 or 5 years of sobriety. He's actively making the best use of his time, educating himself, um, conducting a lot of honest self exploration, and working to serve others with vulnerability and honest confession. Um, SMART goals, I won't go into them here, they're in the paper, but basically they focus on release from prison. One is focusing on a new occupation / professional identity. He'll never fly again. So working on devoting a certain number of hours per week over the years to looking at different job options, skills. It seems like therapeutics may be a good realm for him. The second SMART goal deals with establishing activities, healthy social activities, outdoor things, sports, hobbies, but not just doing them, but also in a social environment because relationships are meaningful to him, and he'll maintain his sobriety that way. Um, and then finally, goals specifically supporting his sobriety. So a regular commitment to a 12-step program or some other substance abuse recovery support program. Developmentally, limits of treatment, developmental needs, ethics. Basically, there didn't seem to be a lot of ethical dilemmas involved. As I said, he's taken a lot of initiative. The only ethical concerns that I listed had to do with confidentiality informing WHIP. The fact that he's involved in the prison system, number one, so they're going to hold his records. The NTSB, the National Transportation Safety Board, and then the court system that remanded him to prison. They're all going to have access to his records, and so all the ethical codes that I listed deal with basically keeping him informed of that and letting him know that his information may not be protected. Finally, treatment needs. He's already actively engaged, involved in the prison's group therapy supporting substance abuse recovery. And so my work with him, so there'd be some interdisciplinary work, communication with that group, my work with him one-on-one, because he is a very sophisticated individual, would be working with his individual needs, his growth, what he wanted to do in his life. Substance abuse and recovery is one aspect, and then the other is, and now what? And so supporting his growth moving forward, maybe addressing some unresolved emotional residue. Probably meet once a week or two, depending on his preference. I would trust him. He seems to be on a growth pattern, and he's got nothing but time. So I will close this up with that. Hopefully I haven't taken too much time. Yes, I have 22:45. That's what I'm seeing for my time. Hey, Jonathan, I appreciate this assignment. I appreciate the course and the way you taught it very much. So thanks for all the opportunity. I also appreciate the offer of letter of recommendation. I may be taking you up on that at some point in the next couple few years. But all right, this is it. It's gone on too long. It's 23 minutes and 10 seconds. So have a great evening.